Dr. Karim Ali is one of our regular guests on The Source. Dr. Ali, we are seeing lower infection rates and higher vaccination numbers, positive signs as we approach summer.
You're right. Things are looking good. Things are looking better than they did when we last spoke. But I would just like to remind everybody that the virus is still circulating in the community. Right? We had 40 new cases today in Niagara. What you really want to do is drive down the infection to single digits, so that we are not in the same situation that we were when we reopened a bit prematurely around the second wave.
I believe the last time we talked, we were averaging over 100 cases, and even at some days pushing up close to 200. So 27 as a daily rate is really quite remarkable in a short amount of time.
It's a very, very reasonable thing. The thing is, like we have to look at about weekly averages. At that time, we were close to 200 something or more than that per 100,000 per week. We have nicely come down to about 64 per 100,000 per week. So remarkable, amount of sacrifice that people have done. They've stayed the course, followed public health measures, and it's bearing fruit.
Dr. Ali, earlier this week, the age group 12 to 17 was able to start getting their vaccinations. I don't think we expected people that young to be getting their vaccinations so soon.
There is, I understand why, that decision was made, but you're right. There is still a fair amount of disease out there. There is a fair amount of large number of people that haven't yet had their second dose, right? So when we tell people, okay, you can do this and that, we always tell them after their second dose. If we haven't completed second dose series, that's that's something that we will need to take into consideration pretty soon. And I'll just chime in here, right? Like we have to think global citizens, right? Like, and I have spoken about this before. There is a large amount of human population that haven't had any access to any vaccines. So high risk age groups, healthcare workers in those areas haven't had the vaccine, yet we have opened up or we have started to talk about and open up to low risk populations at this time.
When we look at the province's reopening plan, this roadmap that was released last week, a lot of it does rely on vaccination rates, and getting into stage 2 and 3 relies on those second doses.
Yep. And that's a very reasonable thing because, this is the first time that we have a very effective intervention, right? Like literally an end in sight. I mean, I'm not saying the pandemic will be over, right? We will definitely see we will most likely see some more waves, but how we blunt them, right, like is going to be dependent on vaccinations and public health measures that we should continue to follow still.
Are the variants still a factor, Dr. Ali, the fact that they are so contagious?
Yes, they are. But, like we discussed before, what works for one variant typically works for the other variant too, right? You have, in order to curtail the rising of new variants and to control the variants, you have to drive the infection rate down, and you do that by public health measures, and you vaccinate people so that a large number of people don't get sick in a small number of time and overwhelm the healthcare system. Unfortunately, this is something that we are seeing play out in countries like India, in Pakistan, Nepal, and also in Africa.
Here in Niagara, we're getting back to some non-urgent surgeries, which is another really good sign.
Mm-hmm. It is a good sign. It is hopeful. It gives us hope, and I want us to cherish that because it doesn't take much for this to go away, right? As of today, we still have 34 or 35 people in the hospital with 19 in the ICU, 19 with COVID-related critical illness in the ICU. These patients are quite sick and require a lot of care. So we are still under pressure. We are not out of the woods. Yes, let's be optimistic, but cautiously optimistic about things.